Also, I wanted to go ahead and ask you, the medical field, I'm sure, is very dominated by white people. So, have you felt racism, any type of prejudice, any type of discrimination in your medical career?
Yeah, from everybody. Patients mostly, honestly.
Oh shit!
Patients are the ones that give me the most discrimination.
Like they
So
don't
I did my
respect you.
training. Yeah, like you, I don't know if it's because I'm a woman or minority. I don't, or a combination of both. But there'll be many times you introduce yourself as a doctor, and they're like, no, I want to talk to a real doctor, and it's like, okay, like. And then you're with a student, you're like a third year resident, and your white medical student gets more respect than you, and you're just like, what?
Shit.
So just things like that, from the patients, and from medical school. I was lucky enough to not really get, only when I did my surgery.
Mm.
I did my surgical rotation, and me and my white medical student, we were both medical students, so we did the same rotation. And there was times where we'd be like, yeah, let's go get breakfast, and we'd go get breakfast, and then we'd be late to like the clinic, or and they gave me like such bad feedback, and they gave him great feedback, and he felt so bad. Like he felt so bad for me, and it was like this was in El Paso, and it was like I remember we would have meetings, and it was like 30 white guys and me. Like so, I was like the only woman and the
Damn.
only person of color in the room, and I'd be like, this is weird. Like it would just make the lack of diversity would just make me feel so uncomfortable. And so, yeah, the student felt so bad because he's like, "How did you get such bad feedback? Like, how did that happen? If we were doing the exact same thing."
Mm-hmm.
So, we you experience small things like that. Luckily, that was erased. But if that would have stayed on my records, like just that really bad feedback, that could have affected like where I could have gone for residency. And where I went to residency was like Miami, so it was a bunch of Latino doctors, Black doctors, like super, super diverse
Mm-hmm.
group of doctors. And it was beautiful, like training there, because the patient, like moving to Houston, I feel like the relationship is not the same. Like I feel like people here, they don't trust the doctors the same. Like there's a lot more mistrust. Whereas when I was in Miami, yeah, the patients would get mad at you if you were like running late, or but they were still very like grateful, and it was more, like you could tell that the culture there, they respect the doctors, and I feel like practicing in that environment was nice. And then I came here, and it's still great. Like the patients are still very nice, but I think because most of the doctors here don't speak Spanish, they're not Latinos.
Mm-hmm.
And they're not Latinos, they're not Black, so they're mostly white, and Asian.
Mm-hmm.
And I think because of that disconnect, they don't. It's like they don't. There's like some form of mistrust, or like there's been miscommunication about things, and so that's something that I've been talking about with my new patients. I'm like, like it wasn't like this in Miami. So I think coming here, realizing too that you're a minority, you're a doctor, and it's so important to have more of that to be able to treat
Mm-hmm.
our patients, because it makes a huge difference.
Mm-hmm.
And I had forgotten that. For 3 years, I forgot, because I was in a totally different environment. I came here and I was like, oh my gosh, like I speak Spanish. Like it's so important to have like doctors be representative of the community that we serve.
Hey El Paso, listen to full episodes of your podcast on the Get Folk Tech channel, and be sure to subscribe to get the latest episodes.